Hi, my name is Dan Schatz. I'm a board-certified internal medicine physician, currently doing my addiction medicine training. I also do plenty of research ranging from alcohol to smoking to opioids, as well as adverse childhood events and incarceration. Today, however, I'm going to talk to you about one of my top interests, and that's something called cost-effectiveness or value-based care. Because I'm in addiction, I like to use an example that often leads to addiction and something that's very prevalent, back pain. So over here we have all the people in the US. Many people are okay. There's also a lot of people who also have back pain, represented by the frowny faces and the red lines indicating the pain. As a public policy, we can actually try and prevent back pain by things like encouraging healthy eating, diet and exercise, or safe lifting at work. But no matter what we do, there's going to be people that have back pain. This is where you might go to your physician and say, hey, I have some back pain, what can you do about it? There's lots of choices you can do. I chose 3 things that I want to talk to you today about. The first is physical therapy. That's been proven over and over to be very effective for back pain and a lot of aches and pains to that effect. The other thing is mental health. Mental health we know is linked to how we perceive pain. And the example I use is when I was playing basketball, broke my finger, but continued playing. And the pain didn't really bother me until after the game when I was thinking about it. That's just one example of how we know that the way we think about things actually affects the way the pain is perceived. So if I'm able to treat your depression, in other words, your pain will actually get better along with that. And the third is represented by this Greek letter mu, which we use for opioids. We could treat you with medications, and it's very easy to just give you a script for Percocet. It just clicks a matter of a click of a button, and the medication's in, and your back pain gets better as soon as you take it. So when an insurance company takes a look at you and you come into the clinic with back pain, and we have these different options, they say, hey, this opioid, it's very easy. It only a few dollars to give you that prescription, and then you don't complain about it. We don't have to take care of you further than that. But if we want to give you physical therapy, that's usually 2 to 3 times a week for many months. That's going to cost a lot of money for the insurance company up front. And then mental health, that's even farther upstream. You need to see them over time and really build a relationship to get the benefits from the psychiatrist or your therapist. So that's also going to cost a lot of money. So when an insurance company thinks about this, they will invest a little bit on this, but ultimately they want you to be happy and say you don't have back pain, and they want to do it as cheap as possible. So they're going to give you the opioids. The problem, though, is that could lead to a progression of your disease, right? You're getting opioids, and now that actually doesn't help your pain in the long run. People still experience as much pain a year out than they did when they first got the pills. Or you might need surgery or injections. And the big thing that we're all concerned about, and I know you've all heard about this, is addiction, the opioid epidemic. That's a really big problem. So a certain percentage of people given opioids will go on to form an addiction. And now there's one of 2 things that could happen. We can either find those people and we can treat them. We have various different effective interventions that we can do. Or we kind of ignore them and hope that they don't do that bad, but a lot of people end up overdosing or ending up in the emergency room. The problem is that is extremely expensive. Extremely expensive. Anytime you go into the emergency room, no matter what happens, your bill is in several thousands of dollars, and that's just at a basic. $3,000 just for the ambulance ride over there, for instance. Treating is expensive. I have to see my patients that have opioid addictions regularly, often weekly, if not monthly, and every other month. So ultimately, why would a government-run health insurance be better? It's because they would take care of you from the beginning to the end. They want to concentrate on the whole picture. So investing in prevention up front that might lead to a decreased overdose in emergency rooms, they would invest in that. That's a worthwhile investment. As opposed to an insurance company who will treat you right here say, hey, we'll give you the cheapest intervention, and hope that when it comes down to here, you either aren't on their insurance or you're on someone else's insurance. And another important thing is the fact that this is actually a healthcare system. It's not the individual. So if you came to me and you had back pain, I'm going to ask about a lot of different questions. There's things called red flag signs. Now, if you give me those red flag signs, I'm going to ignore all of this. I'm getting an image and getting you to the OR, potentially. So we'll adjust to the individual, but this is the whole system at large. The second thing is one of the chief criticisms of government-run healthcare is that the government makes tough decisions about what treatment to apply in different circumstances. This is where we come to hard truth. Healthcare, like anything else, is subject to limited resources. When we talk about cost effectiveness, we are not trying to deny anybody needed care. Rather, we are trying to get the best outcome for as many people for each dollar put into the system. And if that's not enough, the beauty of a single payer system is that everyone could choose to buy private insurance on their own if they wish. The above and beyond care you can still opt into.